So next what we're going to do with the Technology Works is I'm just going to give you a quick overview of the campaign itself, and using slides of the Technology Works. If not, we'll revert to paper and talking. So first thing to mention is that this year is a very notable year for organ donation. I'm not going to go through all of these anniversaries, but one big anniversary is that it's the 60th anniversary of the first kidney transplant. So that's quite a record, and reflects very well on the healthcare professionals concerned. 45 years ago, since the then kidney donation card was introduced, which then became the organ donation card. 30 years since we started doing liver transplantation. So again, we've been at this a while, and we've been very successful, and success rates and survival rates have really increased over the years. And then 10 years since we first put code 115 on the driving license. And since then, 1.45 million people have actually signed up to say, I will be an organ donation. And it's great that most people carry their their driving license with them, so the families can just check. Again, I suppose one of the questions I would ask is, and the IKA would ask is, this would be the great benefit of an opt-in register, that you have 1.45 million people already signed up. So it shows how positive Irish people are about organ donation. So the Minister went through the figures, so I'm not going to dwell on them too much. Last year was extremely positive in terms of the number of transplants that were performed. But if you look at the 5-year average figure, this is the figure prior to COVID, and COVID did have an impact because there had to be a pause on transplants for obvious reasons. So we can see that in terms of the number of deceased donors, we've got back to the pre-COVID period, 86 deceased donors compared to 85 in the pre-COVID period. And then on kidneys, we've actually gone higher than the pre-COVID period. But unfortunately, on the liver, lung and heart, we still haven't quite got back to the pre-COVID period. And again, because we don't have the detailed information, as the Minister mentioned, we're getting into these potential donor audits now. We're not quite sure why that happens. Disappointingly for the kidney patients, that the number of living donors has actually gone down at 33 compared to 35 last year, and then pre-COVID that was at 43. So again, we think that very much reflects pressure on capacity, trying to get ICU beds, trying to get ordinary beds, trying to get space in operating theatres. So it's something we think should be looked at. And if we look at international comparisons, the number of transplants per million of the population, we can see that compared to Latvia, we actually do quite well. We're at 40.3. But if we look at Croatia, which is a similar population, they're at 65.4, so we have a bit to go. And then if you look at Spain, who are the acknowledged leaders in this area, they're actually at 99.5. So we still have a way to go in terms of increasing our organ donation rates. And it isn't just about awareness. Awareness obviously is a key part of the whole process, because if we don't have family consent, then that donation can't happen. But it depends on the number of deaths in hospital, and only about 1% of deaths are actually happening in ICUs. And then it is dependent on that ICU actually identifying potential donors. And again, we all know how busy our ICU healthcare professionals are. And then that family actually had to be requested to donate. And then a medical suitability test has to be performed to see, is that potential donation possible? Perhaps the person has had cancer recently, so then it's not possible to proceed. And then finally the family give their final consent, and then a team has to come and actually retrieve that organ, and generally they're coming from another hospital. And then the organ actually has to be transplanted. So it's a hugely complex with an awful lot of different pieces. And I think it's a great testament to our healthcare professionals working in the system that they managed to do so many donations when you look at the pressures that the healthcare system is under. So the Minister mentioned the Human Tissue Bill, And just to mention that there's a lot of confusion about this, but that family consent is still required. That under the old system, everybody's approached, but under the new proposed system in the Human Tissue Bill, those people opting out, the family will not be approached at all, which is different to other countries that have gone down this route. And then only if the person hasn't opted out will the family be approached for consent. So this is a really key message, we want to get out there, that the family still have to consent. So that's really important that the family have that conversation. The reasoning behind this is that it will change the culture. So instead of healthcare professionals approaching families and saying, would you consider donation? It will be, is there any reason why you wouldn't do donation? So it'll change the emphasis. There will still be a need for family consent, as I've mentioned, and the donor card, the digital download, the 1.5 million people on the register, and then a new one that came in this year with the passing of the Advanced Healthcare Directive. The Irish Hospice Foundation are asking people to fill out my personal wishes and care plan, which sits along the Advanced Healthcare Directive. And there's a space in that as well for people who are patients to say whether they wish to make an organ donation. So again, these are all very important, but it's really important the family know the person's wishes. So in terms of the Human Tissue Bill, we'd like to see a couple of amendments. The first thing is we'd like to see that an annual potential donor audit is actually published. In other countries, they actually publish this information. So you can see right down to the level of a hospital, how many requests were made, how many operations proceeded, why the operation didn't proceed. So I can actually look at a hospital in England and see one operation didn't proceed because of the lack of an ICU bed. So other countries do this, so we shouldn't just be doing potential donor audits on a once-off basis. We should be publishing this information on an ongoing basis. We'd like to see a provision for required requests so that every hospital has a policy where when a potential donor is there, that the hospital has a policy that they must be approached. Because it is, when you think about it, very difficult for healthcare professionals who are dedicated to saving lives to actually ask a family about this. And again, it's important that we support healthcare professionals in doing that, and we provide timing and protected time to do that, training, and also that we allow them to debrief, because so often the healthcare professionals aren't getting the supports they need, and that's why we're seeing burnout. We'd like to see a representative of a donor family on the proposed independent panel, which will review difficult cases, because we think the voice of donor families hasn't been heard enough in campaigning, and we do know, as we heard so beautifully from Naomi, it gives them solace as well, so we think it's important that their voice is there. And then in relation to consent, that it would actually reflect the 9 grounds of the Equal Status Act. So in conclusion, we badly need this Human Tissue Bill. It's replacing very outdated legislation. It provides a good framework for organ donation. It also allows for altruistic living kidney donation, where there's no connection between the donor and the transplant recipient. Currently, people who want to donate a kidney have to go abroad. And we really look forward to working with the Department of Health and ODTI in ensuring increased organ transplantation for everyone. So just to then quickly go into the campaign very briefly, as you've seen, it's 3 different posters in Irish, 3 posters in 3 different languages, and it's all about don't leave your loved ones in doubt. Whatever your wishes are, talk to your family, don't leave them in doubt. And we've partnered with a number of chemist chains who are going to take the donor cards, who are going to display the posters, most of them digitally. Nobody takes paper posters anymore. And it's also supported by the Irish Pharmacy Union and from the Road Safety Authority as well. Another big development this year is that all of the biggest post offices, 370 of them, are taking the donor cards, and then the 350 post offices that have digital displays, they're actually going to be displaying the poster. So we're hoping that way to generate conversations. And if not too far from here is South Andrew Street, and they have a huge digital display if you want to go look at it. And then our thanks again to Clear Channel, because they're providing free advertising. They have a number of spaces in their displays in shopping centres and indoor arenas, so they'll be displaying the poster as well. And then we're hoping that Fair City, and you'll have to watch it I think tonight to see the poster, that the poster will be on display there as well. And then finally, just to mention that this is very much a partnership, it's a community. We're trying to change culture here, and we need to work with our partners, whether it's in the Department of Health, with our other NGOs and charities involved in this, with the healthcare professionals, to identify and understand what are the barriers to increased organ donation and transplantation. And we need to work as a network, as a community, to actually make this happen.